Colorado, Ms. DeGette, for her 5 minutes.
Thank you so much, Mr. Chairman, and I want to thank everybody for coming today. All of us are concerned about fraud in Medicare and Medicaid. When we do these markups of these bills and we have these debates, so frequently people talk about fraud in these programs as if it's the beneficiaries who are committing the fraud. So, Ms. Wooten, I would like to ask you, what is the percentage of fraud in Medicaid that's carried out by providers versus the fraud that's carried out by patients themselves?
Thank you. I appreciate that question. Medicaid fraud control units and thus NAMFUCU, we only have the authority to pursue provider fraud unless the fraud is perpetrated in collaboration with a recipient.
Right, but how much of the fraud would you say is committed by the providers versus the patients?
I couldn't speak to the amount for the individuals exactly, but I would say far more is committed by providers, and the large dollar amounts are going to the large types of providers.
The large types of providers, yeah. And you know, states like all of our states are constantly on the lookout for fraud. And Ms. Gay, I would agree with you. In Colorado, what we're finding lately, a lot of that fraud is from transportation. Just last week, there was a huge coding discovery in Colorado that showed that some people were getting $650 for a transportation under Medicaid versus what should have been $65. Last spring, Colorado's official actions uncovered a ring that improperly charged Coloradoans millions of dollars for non-emergency transportation, resulting in blocking $25 million in fraudulent payments. And I'd like to put in the record a Denver Post article from June 21st, 2026.
So ordered.
Thanks. So, Ms. Tillman, you said that adequate fraud investigation requires coordination on all levels of government. Is that correct?
Yes, that's correct.
And one of those levels is the federal government. Is that also correct?
Yes, that is correct.
Now, at the federal level, the Department of Health and Human Services Inspector General was one of at least 17 IGs terminated in the first days of this administration. So, Ms. Tiltman, I would also suspect that you and probably the rest of the panel would agree that when you're going to hire inspectors general, they need to be qualified for the job, and they themselves need to be not committing fraud. Is that right?
Yes, of course.
Of course. Now, the Inspector General who used to be there was a respected professional who honorably served in HHS for over 2 decades. He was replaced by Thomas March Bell, who was once forced out of a Virginia state government job for misspending taxpayer dollars. And I would ask unanimous consent to put into the record this Washington Post article dated June 17, 1997 about Mr. Bell.
So ordered.
Thank you. Now, Ms. Tillman, about how many fewer employees are at the HHS Office of Inspector General now than there were at the beginning of this administration?
Well, I don't have the exact number. I believe in the OIG's office it is in the dozens at least.
It's about 200, and I would ask unanimous consent, I would ask unanimous consent to put a New York Times article dated January 9th, 2026 into the record, Mr.
So ordered.
Chairman. That's a loss of more than 10% of the employees in the office responsible for keeping watch for waste, fraud, and abuse in HHS. So, Ms. Wooten, I want to ask you, are states and Medicaid fraud control units better to detect and respond to fraud when the HHS IG office is fully staffed and well-resourced?
Certainly in all areas of fraud, to research it, we need a team of individuals who can work together to do that. And when there's a shortfall on one side or the other, we collaborate and make sure that we find the resources we can use to combat fraud.
Thank you. Last month, Department of Justice prosecutors who were leading the fraud investigations in Minnesota that the chairman talked about, resigned in protest after they were directed to investigate the widow of Renee Good, who was murdered by ICE agents in Minnesota. And just yesterday, an additional 8 prosecutors in the Minnesota U.S. Attorney's Office left in protest, leaving the office with fewer than 20 staffers. And so, Mr. Chairman, if everybody's who's supposed to be doing this enforcement's going to leave, I don't think that it's going to help very much to try to investigate waste, fraud, and abuse, and I yield back.
Gentlelady yields. The chair now recognizes the gentlelady from Tennessee, Dr. Harshberger, for her 5 minutes of questioning.
Thank you, Mr. Chairman, and thank you to the witnesses for being